Welcome to the NMI podcast, and we're speaking on this episode with Dr. Adrian Lopresti, and this is a real privilege. I've admired Dr. Lopresti's work over the years, and what we're going to be speaking about is integrative personalized therapy in the field of psychiatry and mental health. And before we get into the discussion, I'm going to give you some background into his experience, qualifications, and work. He's the managing director at the clinical research at Clinical Research Australia, also a clinical psychologist and adjunct senior lecturer at Murdoch University in Western Australia. And a big part of the reason we're speaking to him is because he regularly publishes in peer-reviewed high-impact journals and has completed more than 50 clinical trials investigating a wide number of therapeutics, including saffron, ashwagandha, curcumin, lutein, bacopa, monnieri, magnesium, probiotics, holy basil, and many others. But you get a feel for the kind of work that he's doing. On the area of anxiety, depression, insomnia, cognitive decline, osteoarthritis, digestive conditions, and general well-being in both children and adults. He has over 25 years of clinical experience working with children and adults experiencing a range of mental health conditions, and has extensive experience in utilizing psychological, nutritional, and lifestyle treatments. Importantly, he's the founder of Personalised Integrative Therapy, which is a holistic treatment for depression and anxiety, and regularly conducts workshops nationally in Australia, where he's based, but also internationally as well. And I will link to his website, pitherapy.com.au, and I'd certainly encourage clinicians out there to investigate the website and learn more. There is a practitioner training on there. So welcome, Adrian. It's a great privilege to be able to speak to you.
No problem. Thanks for having me on.
No, it's great. And I think a really good place to start would be to ask you the question, like, how did you get into this? It's not usual for a clinical psychologist to be investigating natural therapeutics and lifestyle medicine, nutritional psychiatry. I've been involved in a lot. How did you get into that from traditional medicine?
Yeah, it certainly started out as a more traditional clinical psychologist. So I was working with children through to adults. I had experience in working with a whole range of different ages. And originally it was the psychological therapies that I was offering, and I was learning more about the different therapeutic modalities out there. And that was great. And I was getting some positive success from the treatments that were being offered. But as I learned more and more about the different treatment modalities, what I found was that the research indicated that pretty much, even though you might do cognitive behavior therapy, or you might do acceptance and commitment therapy, or schema therapy, all these different therapies, the outcomes were still pretty similar. So outcomes weren't necessarily getting any better. So then I looked at, well, what else is impacting on mood and our mental well-being, and I always had interest in nutrition and exercise. So that's when I then went back and started learning more about the link between nutrition and mental well-being. And then I went and did my PhD looking at the relationship between inflammation and depression, and then also did a clinical trial looking at the effects of curcumin as an antidepressant. So I did a randomized clinical trial there and found some positive effects. And then from there, just really continued to go down that path and learn more and more about the relationship between mood and diet and lifestyle and all those different factors.
Yeah. And it sort of shows across your publication history, you've really been deep in this area of lifestyle medicine, nutritional psychiatry, and so forth. And related to that focus on inflammation, that's definitely something I wanted to dive into. One of your earlier papers, which is in Biological Psychiatry, I'll link to this for the listeners in the notes, which was in 2014, was concerned with like functional mechanism-based thinking around the management of depression, looking at biomarkers and how identifying biomarkers related to inflammation, oxidative stress are two examples in that publication, and how they could, I guess, predict mental illness, but also be used to concur with personalized interventions as well. Do you want to talk us through your thinking around that and how that's shaped your work? Because I see that theme through your work since then.
Yeah. Yeah, I mean, certainly, I became more and more interested in that link between inflammation and mood, and particularly with regards to depression. And so, we knew more and more. There was more and more research showing that people with depression or anxiety had high levels of biomarkers or inflammatory biomarkers. There was research showing that many treatments, even your standard kind of pharmaceutical antidepressants, had anti-inflammatory effects. There was research showing that if you induced inflammation in somebody, it would affect their mood and affect their thought, some of their thought processes and their cognition. So that's where then I looked at, more and more the role of inflammation and mood. And what we began to understand was certainly that it wasn't just a serotonin. Obviously, the big theme around depression in particular was that it was a serotonin deficiency theory, and that was just a matter of increasing serotonin and you can improve mood. But the reality is it's far more complex than that. And that's where I'm not saying that neurotransmitters don't play a role. I'm sure that the research indicates from my reading of the research is that they certainly do play a role, but it's not just serotonin or dopamine, it's inflammation, it's oxidative stress. And there's research again showing that people with mental health disturbances have increased markers of oxidative stress and lower levels of antioxidant defenses. And then there was research showing that people with depression and anxiety have high levels of HPA or hypothalamus pituitary adrenal axis disturbances. So there's excess or either increased or decreased levels of cortisol output. There's research showing mitochondrial dysfunction going on and energy production. And then there was research showing around neuroprogression and neurodegeneration, and these neurotrophins like brain-derived neurotrophic factor were lower in people with depression. So there's all these different things going on from a physiological mechanistic point of view. And so that review paper was really looking at, can we look at biomarkers to help identify depression and anxiety, and can we use it to help guide our treatments? Now, the conclusion was it was still preliminary. Certainly these markers are increased or decreased in people with mental health disturbances, but not for everybody. So it was really about trying to identify which markers should we use, how are we going to use them, are they stable enough, do they vary from day to day? And unfortunately, many of the markers that we're using do vary from day to day and even from hour to hour. They might be low in the morning and high in the evening or vice versa. So, but, it's certainly an increasing area of research that's showing maybe we need to look at not only questionnaires and DSM-5 and symptoms, but also look at biologically what's going on and then helping us guide our treatments.
Yeah. And do you just, I guess the big question then is do you think we're at a stage where these different underlying drivers or biological features of mental illness can help us personalize interventions that, you've essentially investigated like anti-inflammatory type therapeutics and with the context of curcumin as an example. Are there subtypes of depression that respond to anti-inflammatory therapies?
Yeah, I think there's certainly I think that there's some people, the main major driver for their low mood could be inflammatory processes that are going on, and so therefore it makes sense to utilize anti-inflammatory treatments. And you could do things like C-reactive protein to help identify where the inflammation is going on, or you could look at pro-inflammatory cytokines to see whether that's going on. But it's when you're just looking at a biomarker in isolation, that's often the difficulty, and so that's the complexity associated with it. So I'm not quite sure. I would utilize biomarkers play a role and they could be useful, but you still want to identify symptoms and you still want to identify what the drivers of those. I mean, ultimately for me, it's about, okay, so this person's inflammation might be playing a role, but what's the driver of that inflammation, or what are the drivers of that? And we know that, and that's kind of links in with that integrative treatment where we know that what we eat could be a driver of that inflammation, how we sleep, exercise, medical conditions. So that's where I'm at. I'm trying to go, okay, there's all these, we know from a physiological perspective, there's all these factors going on, but for the person sitting in front of me, what do I think might be a cause or a factor that might be contributing to their low mood, and then kind of treating accordingly.
Yeah, that makes a lot of sense. So you're thinking about the biology and the biomarkers in the context of the much bigger, holistic picture, basically.
Yeah, and that, because that was the thing, when I originally, I worked as a psychologist, and worked as a traditional psychologist. It was psychological treatments, and the theory was that what I was doing was providing a psychological treatment that was impacting on how they think, and it wasn't a biological treatment. But there was another paper that I also wrote that showed that cognitive behavior therapy, there's some research. I reviewed some of the physiological effects of cognitive behavior therapy. Does it reduce inflammation? Does it reduce cortisol? And some of the research indicated that CBT is also potentially an anti-inflammatory treatment. It certainly reduces cortisol. So even though technically you would argue that it's a psychological treatment, it also has biological effects. And we know that exercise has biological effects. We know that how we sleep, people think, oh, okay, you sleep, potentially, you feel better. But from a physiological perspective, it reduces oxidative stress. It increases antioxidant defenses. It's an anti-inflammatory treatment. It probably impacts on mitochondrial function. So all these lifestyle and dietary and psychological and even social, that relationships have an impact on our biology too. So they all really have a physiological effect in our body.
Yeah, it makes a lot of sense. Like, the therapies you're talking about have multi-pronged sort of biological effects across those pathways you opened up the conversation with. So it's an interesting connection there.
Yeah, absolutely. And so can we use blood tests and biomarkers and salivary measures to identify treatments, to help guide treatments? Maybe, but I think still the value is still in the interview, and trying to identify what's going on for the person and how their sleep is going and how their social relationships are going, and how do they deal with stress, and what do they eat, and when do they eat, and when do they exercise, and who do they spend time with, and all those other things, I think, is what I'm asking for when I'm looking at the interventions that I want to deliver with the person that I'm seeing.
Yeah, that makes a lot of sense. I feel like one way to look at this sort of biological basis of mental illness is that from a sort of, I guess, like a scientific perspective, it helps us understand how things are working and what would be useful, especially in the context of nutrition and lifestyle medicine. But in terms of like clinical reasoning, it's more like pathophysiological reasoning than it is like directly translating that to biomarkers and personalization. It's like, it's just reframing the way we think about mental illness. Yeah.
Yeah.
That's
Right.
great.
Yeah, I think that's the thing. Yeah, I mean, I think the mechanistic point of views and trying to understand how treatments work are really useful, and that might then help guide us to determine new treatments. But when you're looking at the individual that you're treating, then ultimately it's about, really working out what it is. This is where the personalized side of things coming, because obviously the thing with depression is you do a diagnosis, you do a DSM-5, and you go, you've got depression, and you fulfill the criteria for a major depressive disorder. And so then the treatment is, if you go, okay, well, let's give them an antidepressant, but that's not individualizing at all. And you might have two people with the diagnosis of depression who are very, very different in their symptomatology, and therefore also very different in the drivers of their low mood. And so therefore the treatment, even though the diagnosis is the same, the treatments could be polar opposite because of what our assessment identifies in them. So
yeah, it's a great way to frame it. I mean, you could use lifestyle medicine as a parallel and say your only treatment option is exercise, and you're giving that just indiscriminately to everyone, including to people who are already exercising. It just makes no sense.
Yeah.
So
yeah,
it's
exactly.
never.
And that's the same. There was a thing with psychological therapy. It was like, people were coming in and they had years of psychological therapy, and then I see them as a psychologist and I go, okay, well, let's give, I'll offer another psychological therapy, or maybe my magical psychological, maybe the way I present it's going to be different. But, well, maybe we need to look at something else. Maybe rather than offering more psychological therapy, we needed to offer dietary interventions or exercise interventions or supplements or those types of things that we weren't considering which I wasn't considering as a traditional psychologist.
Yeah, absolutely. And it's easy to understate. I think a lot of our listeners we're preaching to the converted, so to speak, but it's easy to understate how radical this approach still
Yeah.
is in conventional medicine. The mainstay of treatment still is psychological therapy and
Yeah.
pharmacotherapy, really. But it's changing, and you're at the front of that. So I think what I'd like to spend a little bit of time is jumping into some of the therapeutics that you'd studied to unpack those. And I thought some great examples were saffron, ashwagandha, and recently you've published some work on magnesium glycinate as well. So with this more broadly, I guess generally speaking, with all the clinical trials that you've been involved with, what have you come to learn around things like clinical efficacy, safety, and mechanisms of action? I guess we could pick one of those as an example, starting with saffron, or
Well, even all of them. I suppose often when I present on herbal ingredients or nutrients to help improve mood, I talk about the mechanisms of action, and they all have they work on different processes, I suppose, but still they're all, most of them are anti-inflammatory. So they all have anti-inflammatory effects. They have antioxidant effects. So we've got the inflammation targeted. We've got the oxidative stress potentially targeted, because certainly saffron, ashwagandha, even magnesium has antioxidant effects. Then we've got mitochondrial activity, and they all, a lot of herbs and nutrients have mitochondrial activity. Then we have HPA axis modulating. What impact does it have on cortisol? And generally, a lot of herbs and ashwagandha's been lots. Ashwagandha, saffron, even magnesium reduce cortisol, have an impact on cortisol, and may impact on the autonomic nervous system. And there's been some studies showing that many of them also impact on things like heart rate variability, which may be a marker of kind of parasympathetic activity. So you've got all these different mechanisms that many herbs, and they're multiple mechanisms because they contain many actives in them, generally the herbals. So when I'm often presenting, I go, yep, tick, 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 tick. Some might be have a stronger anti-inflammatory effect and a lesser HPA axis modulating effect, but they still generally target all those different areas, as unlike a pharmaceutical, which may have a more specific individual target of action. So from a mechanistic point of view, it targets all those things that I talked about. They also, have neuroprotective effects, is also what they're showing. So that's the beauty about a lot of the natural ingredients, is they have multiple mechanisms of action.
Yeah, that makes a lot of sense. Yeah. And related to that, broadly, could you make sweeping statements around efficacy of some of these?
Yep.
Like, saffron as an example, or
Yeah, I mean, there's an increasing body of research for a lot of nutrients which you never have seen previously.
Yeah.
Now, things like saffron, there's been more than 20 clinical trials looking at the effects of saffron, particularly the strongest body of evidence is with regards to depression. So I think there's really strong evidence now that saffron has positive antidepressant effects. For people with mild to moderate depression, mild to moderate depressive symptoms is generally where its greatest efficacy is. So ashwagandha is more around kind of your stress, anxiolytic effects. So that's where it has its greatest body of evidence there. Magnesium, interestingly, theoretically, it makes a lot of sense, and I've used it a lot in clinical practice, but there's not the research is increasing, but I used to use it a lot for sleep and things like that. There wasn't a lot there in terms of good body of evidence. But I think magnesium from a stress perspective and and sleep perspective. Even saffron now has got research. I've done a couple of studies now for saffron for sleep, and it's had some positive effects on sleep. So they're all increasing. They're not magic pills. And one thing I really want to highlight is, I never in my practice have I ever said, somebody comes in and say, oh, I've got depression. I go, okay, well, here is saffron. Go away and see me in 4 weeks. It's not like that. But as a component of an intervention, of a holistic intervention, they certainly can play a role. And they have a positive effect. For some people, they seem to have a really, I haven't been able to determine it, but some people rave about it and they get really, really major effects. But generally, the mild to moderate effect sizes that people are getting, they're safe, they're well tolerated. The most common adverse effect, which is uncommon, is your digestive related complaints, maybe sometimes headaches, but they're generally mild. I've never had any severe, in all the 50 clinical trials we've done, we've never had any severe AEs. So very well tolerated as an adjunct intervention or as a component of a holistic intervention. I think they're really, really useful.
Yeah, that makes a lot of sense. And, I appreciate the context there of where these really play a role in wider, therapy and care, not just as, green pharmacy or replacements for drugs, basically.
Yeah, I think unfortunately, I'm probably contributing to some of that magic pill mentality, because I'm doing these individual clinical trials looking at a single ingredient delivered on its own, which I would never just do on its own. But
yeah.
And one of the things that I regularly get asked is, how clinically meaningful are the interventions? So when I'm writing papers, they go, well, is it clinically meaningful? And I'm kind of going, well, as a component of intervention, it is clinically meaningful. If you do 10 interventions that all help 5-10% each, collectively, it is an extremely powerful intervention, and I'm not relying on solely just one. So, and they're safe and they're cost effective, and all you're doing is taking one pill a day. And so you can't compare like to like. Like, people will go, well, how does saffron compare to psychological therapy? Well, saffron costs you $30 a month. You take one pill, which takes you about 30 seconds a day. You don't have to go for drive for an hour to see your psychologist, sit for an hour to see so you can't compare the investment is far less. And so therefore, I would expect that the outcomes should, to be equivalent. They don't necessarily have to be as major as psychological therapies. But as I said, as a component, they're extremely helpful.
Yeah, that makes a lot of sense. We'll get to a trial that you're involved with that looked at a more integrative approach, like a multi-component intervention. But before we touch on that, I just wanted to highlight, I guess for listeners actually, because it's such a brilliant state of the science. It was a paper let me just bring up the name of it. But it was a review of here it is, Clinical Guidelines for the Treatment of Psychiatric Disorders with Nutraceuticals and Phytoceuticals, the World Federation of Society of Biological Psychiatry and Canadian Network for Mood and Anxiety Treatments Task Force. That's just a small mouthful, but really great reference for clinicians, huge collaborative international initiative. Can you talk us through that paper and what it was about and what its position is?
Yeah, so that was released in 2022 now, so it's about 3 years now. But it was 31, I think it was about 31 researchers and clinicians from around the globe, and it was great. We had a whole range of experts kind of reviewing some of the research on different nutrients and different herbal ingredients. And we looked at the strength of the evidence, looked at different interventions being offered for unipolar depression, for generalized anxiety, for bipolar depression, those types of interventions, and looked at whether, how strong was the evidence for the different ingredients. And so unfortunately, the reality is that there were many ingredients that had single trials, 1 or 2 trials that demonstrated efficacy, but there weren't a lot with ongoing several studies done in multiple populations, done in multiple settings. So there wasn't a lot of that. So, but what was the biggest body of evidence for unipolar depression as an adjunct intervention was omega-3 fatty acids, so 1 to 2 grams a day of EPA a day, had the strongest evidence for depression. And then there was some provisional recommendations for probiotics, zinc, saffron, and curcumin. So curcumin is another one I mentioned I did studies on. So there was those for depression, and also saffron and curcumin was also provisionally recommended for as a monotherapy for unipolar depression. St. John's wort was also another one that was recommended for unipolar depression. There wasn't a lot for like generalized anxiety. So in terms of strong evidence for generalized anxiety, there wasn't any, but ashwagandha and lavender were two that had some provisional recommendations from the group. So it was a really good opportunity for us to review all the research in the area, look at the strength and quality of the evidence, and then provide some guidelines on some nutrients which have stronger efficacy and safety for different mental health disturbances. So it's available for free for people to download, so they can certainly download that and have a review of the research.
Yeah, no, I appreciate that. It's a great overview, and I think an important paper for people who are practicing in this field to get a sense of the evidence for what's out there.
And there's been a lot more since then. So obviously it's 3 years old. So now it probably needs another update. But yeah, I think it's a good guide.
Yeah, you're right. It's, things seem to be moving fast in the field. I've never seen it like this before. It's really, it seems exponential almost.
Absolutely.
It's great. Moving from like those, those individual interventions studied, through the lens of a randomized controlled trial, I wanted to bring the discussion out a little bit into a multi-component intervention study you were involved with for depression and anxiety. That, for listeners, again, I'll link to this, but the title of the paper is The Feasibility and Efficacy of a Brief Integrative Medicine Treatment for Adults with Depression and/or Anxiety. And that was in the Journal of Evidence-Based Integrative Medicine back in 2020. It feels a long time ago now, but an important example of where these things fit into the wider context of integrative care. So can you talk us through a little bit how this study came about and what you learned from it?
Yeah. So this study here, what I wanted to do was to, rather than look at an isolated ingredient, look at it as how efficacious is an integrative therapy. And so at that time, I developed something called a treatment called Personalised Integrative Therapy, which was an intervention that looks at where you administer psychological therapy, where you administer interventions to support social interactions and social support and spiritual components in terms of purpose and meaning. There's also exercise and supplements and diet. So it's a really holistic approach. And I wanted to look at, how efficacious does an integrative therapy compare to the gold standard cognitive behavior therapy, I suppose. And so it was a study that was quite difficult to get off the ground because ethics often rejected it or required modification several times. Because one of the questions was, when you do this study, how do you know which bit worked? And it's like, that's an integrated treatment. You can't just take one part away and look at a part in isolation because they all work together. And so eventually we got ethics approval for it. And it was only a small study. It was only 48 participants with depression and anxiety. And they were adults with self-reported depression. And all we did was we delivered a one-day workshop where it was either CBT-based, it was integrated education there. So it was one group received CBT one-day workshop, and then they got phone messages and phone texts reminding them of the things we covered and goals to set and things like that over the next 6 weeks. So either it was a CBT delivered one with the phone texts and messages, or the integrative therapy one, which was, hey, remember about your exercise and diet and those types of reminders that they were getting over a 6-week period. So that was the two groups. And then the third group was integrated therapy plus supplements. So the other two didn't have any supplements. And so the third group we gave them fish oil, probiotics, magnesium, I think it was a B complex, and a curcumin saffron combination. And so we used self-report questionnaires to assess change over time. And what we found was that the integrated therapies were, I'd say, as effective, if not more effective. From a statistical point of view, there wasn't enough power in the study to identify statistical significance for some of them. But in terms of depression, 50% of people, or 58% of people receiving the PI therapy plus the supplements no longer had depression at the end of the treatment. So it was the integrated therapy on its own, there was 42%, and then the CBT, there was 33%, so only a third. So it was nominally the integrated therapies were more efficacious. Similar trends with anxiety, but one of the things we did find was that the integrated therapy plus the supplements, they did far better from a sleep perspective. So we also asked about their sleep and changes in their sleep. So there was a 44% reduction in their sleep-related symptoms in the PI therapy plus supplements, 21% in just PI therapy on its own, but only 8% improvement in the CBT. So, what we showed from that was that there was certainly nominally a greater efficacy in the integrative and potentially supplements from a sleep perspective compared to cognitive behavior therapy. I admit that it wasn't, CBT is generally offered weekly for 10 weeks. We didn't offer that because we just didn't have the funds to do that. But certainly it was 1 day, full day workshop plus support through phone, text, and messages.
Yeah, it's fascinating. It's interesting to see these kinds of things head to head. It's, often these, you just don't see this kind of research. It's an unusual study for that reason, I think. And nice to see the use of supplements contextualized in more integrative, care like this as well. So small but fascinating and, really interesting study design.
Yeah, absolutely. I think it's certainly more realistic in its approach for a lot of practitioners who are offering an integrative intervention out there. So rather than just supplements on their own.
Yeah, I think that's a big thing, isn't it? Like for healthcare providers that are making decisions and utilizing integrative approaches, that it feels a lot more resonant and meaningful to see this kind of work done for the people on the ground treating patients. Maybe not for an ethics board or a funding source, but for the people out there making the difference where the rubber meets the road. This is the kind of work I feel like that needs to be done.
Yeah, and that was the goal. It was really about providing some justification and evidence of this integrative approach, and we're seeing that it received well, and outcomes from a depression, sleep, and anxiety perspective were really positive.
Yeah, no, that's great. No, thanks for sharing that. It's nice to have your insight, and I think also what I wouldn't mind touching on with your experience is, I've got a lot of listeners that are, in this field. They're seeing patients, they're looking at utilizing things like nutraceuticals and phytoceuticals or herbal medicines alongside, their standard of care. I guess what I wanted to ask you around this consideration is, what are some big things they need to be thinking about in terms of like training, evidence-based use of these, thinking about biomarkers, safety? I mean, these are big questions, but do you have some overarching thoughts for listeners on how to navigate this world?
Yeah, it's interesting. I mean, when I originally started, I did everything I could to get the training and education, because there wasn't necessarily any courses that you could utilize. So I know that you've got a workshop in October. So going to events like that were crucial to help me understand and learn more, and also realize how much more I needed to learn in the area. So I think training, whatever you can, from workshops and from webinars and podcasts and those types of things are really good. And there's some great books and resources out there. So I think that's really important. I think it's also about identifying your area. I mean, identifying your area of expertise. So like, so you could be obviously for me, it's, you could be a psychologist, and so your primary area of expertise is psychology, potentially psychological treatments. But that doesn't mean you can't do some intervention around diet and provide some education around that, and provide some support around exercise and those types of things. But ultimately, if based upon your assessment, so for me, it's always going, where should I, for the individual that I'm seeing, where am I going to get the greatest outcomes for this person that I'm seeing? So if they're coming in with major sleep problems, I want to dedicate my energy towards improving their sleep. So if I have the expertise to provide sleep-related interventions, or should I, and maybe I can provide some minor interventions, some supportive interventions around that. But if I think that's where all the primary intervention needs to be targeted towards, then referring on and utilizing practitioners that have expertise in diet and have expertise in if you're a naturopath, for example, and you can provide some education around psychological therapy and some support around that. But if you really think that psychological therapy is important, then referring off to a psychiatrist or a psychologist or a mental health counsellor would be the way to go. So having a good tool, a good group of practitioners that you can refer on and receive referrals from are really, really useful. But the other thing in my mindset is also that, for me, it's not, intervention doesn't have to be complex. If you can if somebody comes in and I can provide 10 small changes, which each on their own may be insignificant, they might not help that much, but you provide 10 small changes that each help 2 to 5% each, and you put them together, collectively they're a very, very powerful intervention. And the question will be, which one worked? It doesn't matter. It's a combination of the two. And, a little bit of exercise, improve their mood by 5%. Supplements, improve their mood by 5%. Reducing soft drink consumption and increasing more water intake, reduce their stress hormones by 5%. So all those, I think that's where we need to kind of think about all those different interventions and putting them all together.
Yeah, no, it's a really great insight. I think one of the dangers in this field is getting lost in the complexity and, of the illness and also the interventions that we've got. So to ground it back into a real world example of making small, easy to achieve changes that have cumulative effects and are practical and pragmatic, both for the patient, but also for the clinicians. A lot of our listeners are medical doctors who are in quick setting, clinical settings where they don't have a lot of time. So making, small, pragmatic, easy to implement changes are going to be really important.
Yeah. Look, I was reading a paper the other day that it was done a while ago, but even they looked at people and the amount of fluids that they drank. And they categorized people with high fluid intake versus low fluid intake. And they looked at its impact. And then they exposed them to an experimental stressor and looked at their cortisol response to the experimental stressor. And people who drank more fluid had a lower cortisol reactivity compared to the people who weren't drinking so much fluid. So those little things, which sound like a nothing intervention, but as I said, you put all them together and they are extremely powerful.
Yeah, no, that's a fantastic illustrative example. So to wrap this up, I think you've been in this area of lifestyle medicine, integrative psychiatry or nutritional psychiatry, whatever we want to label it. It feels like a really new field still to me, although it's moving along in leaps and bounds. So, for someone who's really involved in spearheading this movement or, being at the forefront of both the research and the advocacy and being grounded in clinical practice as well, is like, what do you perceive as the main barriers to widespread adoption of a more integrative approach to mental health? Are there big things in the way of getting this out there and helping people better with this kind of approach?
Yeah, look, obviously, as a researcher, really big on ensuring that there's lots of research, robust research out there to confirm that what we're doing is safe and efficacious. So I think that's really important. And the problem with that is trying to identify funding. And so I've got my own contract research organisation, and the only way we do studies is not through government funding, because it's so difficult to get, is through sponsor-driven trials. And that's then we sometimes criticise because they go, well, the study was sponsored by the manufacturer of the ingredient. And we go, yeah, but they were that interested enough to invest in a clinical trial on their ingredient. We run it independently. Results, we guarantee that we complete the study, but we don't guarantee the results. And so sometimes it's positive, sometimes it's negative. But then it gets criticised because it was sponsored by the manufacturer, and so that's always an issue. There's also an issue, I think, that, same with pharma studies, is that the positive trials are the ones that get published and the negative ones don't. So I think that's still an issue generally. And I'm increasingly concerned by some of the studies that are out there that I kind of question the robustness of it. I'm trying to put it in a nice way, but so yeah, all I can say is if you read a study and the results look amazing and they look too good to be true, then they probably are, and question it. How can an intervention solve all problems and solve all symptoms? And if it's doing that in a paper, then question the validity of it and see whether it's been replicated by another independent researcher or research group.
Yeah, no, that's great advice. And I wouldn't mind just quickly touching on two of those points. The first is industry funding. And I think that's one of my pet peeves, actually, is when people instantly dismiss a paper because of the funding source. It's not a carte blanche to dismiss the credibility of the paper. We need industry desperately. And I think particularly in this field to support research and funding. But so I just echo you a bit on that one, I guess. And the other piece is, yeah, I think that ability to, critique and navigate the research out there is really important as well. Yeah, I'm sure you see the same in, your environment in Australia, but here we see a lot of science being communicated by the brands providing the products and so on, and it does get manipulated because it becomes marketing, basically.
Yep.
I'm trying to think of a nice way to put it as well. But it's,
Mhm.
yeah, I think very important for clinicians to be able to sort of cut through that a bit and be able to read through it, which is why we're speaking to people like you and highlighting, independent resources that do give us a perspective of what the evidence is. They're really important points.
Yeah. I think that's I think you summarise that well. And yeah, this is where even things like a lot of people, what is the clinic? Is it clinical significant in terms of the outcomes that are obtained? So a lot of people will go, a lot of supplement companies will go, look, our ingredient reduces cortisol, and it's like, yeah, okay. Is that a good thing or a bad thing? Because actually, sometimes it's low cortisol. Like, for example, people with PTSD, generally the research shows that on the bulk of it, they have low cortisol. So if you don't want to lower their cortisol even further. So you want to potentially maybe increase their HPA axis activity and their HPA axis reactivity in certain circumstances. So question what it is that potentially the marketing is saying, and is it accurate, and
Yeah.
are they also picking out parts of the study that showed positive findings and ignoring the negatives? So that's always something to do. And so I think it's really important for people to be able to just not read an abstract, but be able to read a study and go, okay, I question, this is a good study, or I question some of the conclusions that are made by the authors of the study. So
Yeah, no, that's a great example, and I'm going to go off on a bit of a tangent here, but one of the papers of yours I really liked was this. It was like a narrative review on curcumin and its mechanism of action, and I was, I'm not claiming that I was thinking the same thing at all, but it was looking like that to me as well, is that there was this huge drive by industry to enhance bioavailability. But, for listeners, your paper really flipped that on its head and said, well, actually, maybe the mechanism of action is based on the fact that it isn't well absorbed and it's working locally in the gastrointestinal tract. I just thought that was an absolutely brilliant commentary that was a bit of a myth busting type paper as well.
Yeah, that was one of again, that was one of my pet peeves was, all this work and all this uh, promotion and marketing about like, our curcumin extract has greater bioavailability. It's like, okay, well, can you tell me whether it's actually more efficacious? Does the increase bioavailability increase efficacy? And they weren't able to kind of say that. And then it was like, well, it's not absorbed in the blood, but it's still having efficacious effects. So it must be working through another mechanism. And obviously now we know, the gut microbiome and the gut-brain axis has such an important effect on not just mental health, but in general health, general well-being. So, and maybe that was the conclusion was, certainly maybe it's working on the gut microbiome and working on the gut that potentially is influencing the brain.
Yeah.
And so bioavailability didn't matter so much.
Yeah, absolutely. It's a great point. A previous guest who's sort of been deep in supplements as well said something very similar, is that, bioavailability doesn't necessarily translate to better efficacy. They're two distinct things. But the assumption is in marketing, it's going to work better.
Yeah, it's certainly very well. You market it. Ours is 50 times more bioavailable, which is terrific, right? Yeah. So,
It's definitely not
that's the
50
other
times
thing.
perfect.
That's the other thing when it comes to, when we talk specifically about supplements, there's so many different, when it comes to different ingredient forms and extracts available. One of the things I certainly would encourage people is that they question, has this specific extract undergone trials examining its efficacy and safety? Because we know when we go into a fruit and vegetable store that two apples are not the same. They could be very, very different. And the ingredient content and the could be very, very different. And that's the same. So generally we do trials on ingredients that can be replicated and patented ingredients. So just be a bit careful about companies going, yep, we have saffron, and so therefore ours works well. As your extract, does that actually work? Have you got evidence? You can't borrow science from other people, which is what is definitely happening. There's a lot of borrowed science.
Yeah, absolutely. It's a really good point. And, I think there's some great pieces of food for thought for listeners there in helping them navigate this field. Looking at evidence-based prescribing is just looking for the evidence is a great starting point. It's very, very salient. So I think we'll need to draw to a close. It's been a really brilliant conversation. I've really appreciated your time and expertise in this area, and wonderful, to walk through this journey of like what integrative therapeutics in the field of psychiatry are, incorporating nutrition, lifestyle medicine, herbal supplements, running through your clinical research, and then framing this in the bigger picture of where this fits into integrative care with some salient points to help people navigate this field has been really enlightening. So, thanks so much for your time. I really appreciate it.
No problem. It's been great having a conversation with you about this, and keep up the great work that you're doing.
Yeah, thanks very much.